Top educational sessions to explore, covering the topics important to you, the physician anesthesiologist. From support of women in medicine, pushing to take their career to the next level, to caring for our minority patients suffering from chronic pain. Plus understanding new approaches to benefit those we serve. An overall theme continues, putting patients first. This is the Anesthesiology Annual Meeting. Hello, I'm Sarah Panko. Here at the annual meeting, you can find developments in the specialty with ongoing research and advancements in science to improve the care of your patients. Meeting the challenge of burnout is crucial for any clinician. ASA is responding to the National Academies of Sciences report on the subject. Among the alarming research, the suicide rate among male anesthesiologists is the highest. It's crucial that we shed light on this issue to come to a solution.
This is something we need to be proactive about, and it is much more far-reaching than simply a lecture or a website. I recognize that. But that's where the conversation starts, and that's where you can start talking about more systems and policy levels.
There are some things you can do to improve yours and your colleagues' well-being.
Burnout affects patient safety, it affects quality, and I love the analogy that Amy gave, that it's like the canary in the coal mine, that clinicians are like the canary in the coal mine, that it's not a clinician problem, but that we actually are a sign that the whole system, the whole environment is a breakdown, and that we have to actually look at this as a systemic change.
Shaping our profession for growth in the future. But where are those opportunities in both the practice and your development? Dr. Lauren Sen discussed the work being done in the field of labor analgesia.
We created this what's called dural puncture epidural technique, where we placed a spinal needle through that epidural needle. We left that hole behind, but instead of dosing anything, we just threaded the catheter, gave the full activating dose as we would with a traditional epidural, thinking that some of that medication will translocate through that hole. And indeed, the studies that we have done have proven that concept.
It's information that obstetric anesthesiologists value.
Talking about the different types of ways that we can decrease the rates of general anesthesia for cesarean delivery was very important, as I think it's a very prevalent process in community hospitals.
He discussed what's called the dural puncture analgesia, and that would be something I would think about implementing.
I'm a fairly experienced anesthesiologist. I've practiced for like 35 years, and I've worked internationally. I've worked both in the US and in the UK, and mainly in Africa and the Caribbean. And we've always had challenges with obstetric anesthesia. It's terrible in the less developed world, because we don't have the resources and the expertise, and we don't have enough information about what is happening.
A unique learning opportunity requiring you to get involved. Similar to the game show Jeopardy, the divided audience answered questions. Each had a point value. Audience members could answer without being singled out, then get a more detailed explanation of the answer from the panelists. Topics included pain and addiction, nerve block complications, and acute pain.
It actually brought my attention, which is it's very important to think about the adverse effect that can happen during nerve blocks, and what do I have to think in terms of contraindications. So we need to have more interactive sessions like this, which is very important, where audience can communicate and give their suggestions and recommendations.
The future is electric.
It'll be iPhone size someday, or double iPhone size. It's only a matter of time.
Dr. Warren M. Zapol revealed the advances of electric nitric oxide for critical care. From adults and newborns, there is opportunity for nitric oxide therapy. The research began with a dozen sheep, a hematologist, an anesthesiologist, and their chief resident.
We opened the windows in the lab, we all wore gas masks. We gave the NO to the sheep, tightened his pulmonary circulation up to 46619 of prostaglandin and the peroxide, and then we showed very clearly that we could drop PA pressure.
Sometimes we need a refresher course or to learn more about a certain topic. Among those, the basics of excitation, contraction, coupling. Some of the things reviewed included periods and triggers of patients more susceptible to arrhythmias and the mechanisms of developing arrhythmias. As you attend the sessions of importance to you, remember that we've made claiming credits easy. Thanks to Beacon Technology, if you're in the room for 15 minutes, it gets added to your credit card. You can also visit a credit claiming station. For ASA TV, I'm Sarah Panko.